Yes, good luck. Now, botched breast implants, Botox nightmares, lip filler disasters. We all hear about the horror stories concerning cosmetic surgery. And this morning, if you're thinking about getting cosmetic procedures, you're being urged to ask tougher questions to the professionals who are carrying out those treatments.
Yes, the General Medical Council has released the cosmetic guidelines, a list of 8 things patients should consider before going ahead with any procedure. But just how effective will this be at preventing cosmetic catastrophes?
Well, one person who knows the dangers about not asking enough questions is former Towie star Abby Clark, whose 10-minute lip filler procedure turned into pretty much 6 months of hell for you, didn't it? And also Sally Tabor from the independent organisation Treatments You Can Trust. Good morning to you as well. Thank you both very much for coming in. So, Abby, I mean, you know, tell us what happened to you, because it was all a bit of a nightmare, wasn't it?
Yeah, I went to Harley Street, where you'd think was quite renowned to feel safe in a place where you could go and get something done, and I kind of had my lips done and it went completely wrong, so I had 6 months of hell with blocked filler that reacted with my lips, that kind of went into a block which pushed my lips out, which started to split my lip in the middle, which was agonising, kind of went really lumpy, made me feel embarrassed, uncomfortable, and it just was not pleasant at all.
So this was no rogue guy. This was a Harley Street cosmetic surgeon.
Yeah, which is
and it went wrong.
So we can see the picture there of that's what happened.
So this is not some backstreet, you know, operation going on here. This is Harley. So there's a clear problem within this industry.
First of all, let me say what the General Medical Council have done today is excellent, but it's only for doctors. So what we're calling for is that the guidance is similar for nurses and dentists. And I'm sorry to hear about Abby in Harley Street. I expected her to say it was in the back of a nail bar or something inappropriate, or when I was first doing this work, somebody had it done in a garden shed. You expect that kind of treatment, but I certainly would like to follow up with exactly who did that and to make sure they are appropriately trained.
But listen, is what they're saying really excellent, though? Because actually, you know, what does this really do? Why don't we have proper regulation of the people that are carrying out these procedures?
But the General Medical Council is a regulator, so they can regulate their doctors and have assured in their press release today the public that that's what they're going to do.
So, but you can issue a list of guidelines or recommendations, and it's all very good, but how can it be enforced? Don't you need some sort of legal enforcement of some sort of standards in this in this industry?
We have got standards. Treatments You Can Trust set up standards in 2010. The register was acknowledged in the Keogh review. It is now running independently. It checks if you're on the Treatments You Can Trust register, then a patient should be able to check that practitioner is appropriately trained and it's being done in the right environment with the right products.
OK. Well, Abby, what do you make of this, though? Because, you know, there's this list here of questions that you should be asking somebody, but presumably, I mean, I don't know what questions you asked the person that carried out your procedure, but if you're keen to have something done, then although you might kind of go through it, do you think this goes far enough?
I think there are maybe a couple more things that could be put into place, like you said, something that's actually with the government in line to say you have to be qualified, you have to have a certain years experience, or you have to be specialised in that to do that. Obviously, it going wrong for me, I can now step back and think, actually, I do need maybe something like this list where I can actually feel comfortable, and I do think that is a good thing, definitely 100%.
Can I say that our guidelines now put in place, Health Education England, part of the government's review of this industry was to set up a review of qualifications, and that has been released by Health Education England with a qualification framework, and to be giving Botox and dermal fillers, one should be at level 7 of the qualification framework, and that's really, really important.
Thank you both for joining us this morning and talking through that, because obviously, you know, you've managed to resolve your situation, but that's not the case.
You look great now.
And if the public could remember go to treatments
Yeah.
you can trust register.
Okay.
Thank you so much.
Check.
No,
Thanks
thank
for
you
carrying
both.
it out.
Thank
Thank
you.
you.
Thanks, Abby. Thanks for coming in.